Labour market discrimination. Discrimination occurs when the marketplace considers arbitrary factors such as ethnicity and gender when making economic exchanges. I'm going to explain to you how labour market discrimination contributes to worse health outcomes. Wage discrimination occurs when equally productive workers are paid different wages based on some arbitrary characteristics. As you can see, women only earn $46,746 per year as assistant managers compared to men's $49,586. Human capital discrimination prevents certain groups from acquiring the level or quality of education or training to which other groups have access. For example, despite recommendations that teaching should occur in Aboriginal languages, schools in Australia teach in English, which can result in lower academic comprehension in Indigenous students, as English is sometimes Indigenous students' second or third language. Employment discrimination occurs when certain workers aren't hired based on some arbitrary characteristic. For example, workers that were applying for jobs were called back at higher rates if their name sounded white than if it sounded like it was from an ethnic minority. In a similar way, occupational discrimination is not hiring a particular group for a particular job, resulting in occupational crowding. Occupational crowding is seen in speech pathology, in which 98% of workers in this field are women. Similarly, only 1% of refrigerator mechanics and installers are women.
This contributes to the gender pay gap as women are crowded into occupations which pay less than the occupations men are crowded into.
There are many environmental factors which contribute to health outcomes amongst different groups in society. In 2008, non-Indigenous adults were more likely to have attained at least Year 10 or basic vocational qualifications, 92%, than Indigenous adults, 71%, and were over 4 times as likely to have attained a bachelor degree or higher, 24% compared with 5%. As you can see, education is a way to combat employment inequality, with almost no gap in employment between Indigenous and non-Indigenous peoples with a bachelor degree. Unfortunately, due to this social gradient, Indigenous people are precluded from work. Based on all sectors of employment, the median weekly income of Indigenous peoples was 33% lower than those who are non-Indigenous in 2019. Now, this is really sad, and particularly salient in light of the recent uprising of the Black Lives Matter protests. Indigenous peoples, especially youth, are much more likely to be incarcerated than non-Indigenous people due to a cycle of crime. Fetal alcohol syndrome disorder is a contributing factor to incarceration rates in Aboriginal and Torres Strait Islander communities. Given the complexity of the problems and comorbidities amongst the prison population, strong linkages between the health and justice system are imperative to breaking the cycle of disadvantage. Aboriginal and Torres Strait Islander peoples have lower wages and less years of formal education than non-Indigenous people due to the ongoing impact of colonization. As Mitchell states in the 2007 edited book, Social Determinants of Indigenous Health, several illnesses were introduced when Europeans arrived in Australia, including smallpox, tuberculosis, influenza, whooping cough, measles, and venereal infections. These caused both deaths and social disruption throughout Indigenous Australia. These diseases spread ahead of the Europeans, so Indigenous peoples were severely hampered in their attempt to fight off the Europeans when contact was first made between the groups. The declaration of Australia as terra nullius was supported by a scientific theory at the time that supposed that Indigenous Australians were evolutionarily inferior to white people. Indigenous peoples not being counted in the Australian census perpetuated that idea. It was only in 1967, one generation ago, that Indigenous people began to be counted as people on their own land. The tragic assimilation policy did not value Indigenous cultures. Accepting other cultures has positive social outcomes, as Baum stated in 2007. Societies with high social capital are integrated and accepting of difference, and have high social and civic participation with networks which produce cooperation and trust among the citizens, resulting in a more straightforward and effective way of working together. These societies also have low rates of alienation and anomie. As Keenan states in their 2009 paper, Indigenous Education and Social Policy Development in New South Wales, connection to culture positively influences Aboriginal health. Not only are there social benefits, but Borjas found in his 1995 paper that there is an economic benefit derived from the skills brought to a labour force from different cultural backgrounds. The Aboriginal Protection Boards, ironically, did nothing to protect Indigenous people and led to the ongoing stolen generations. Today there is a large proportion of Indigenous youth represented in the child protection system, and not living with your parents is a determinant of ill health. The exclusion on demand policy prevented Indigenous peoples from attending school if a white Australian requested as such. Ongoing racism, especially that which is manifested as exclusion, has deleterious effects on Indigenous people's mental health. Poor mental health is correlated with unemployment, according to Clark and Oswald in 1994, which further compounds the disadvantage experienced by Indigenous peoples. Due to these historical policies and other unexplained reasons, a significant gap exists between the life expectancy of Indigenous and non-Indigenous peoples. It's worth noting that trauma can be inherited, and the ongoing effects of colonisation are the cause of much of the mental health issues experienced by Indigenous peoples today. Governments should address Indigenous workers' needs by investing in mental health services, as they provide up to a 5.7 to 1 return on investment, according to Chisholm et al. In their 2016 global study. Get mad and protest. Nothing changes if no one fights for it. Governments need to address racism to reduce employment selection prejudice amongst ethnic minorities. Additional education services are required to close the gap between Indigenous and non-Indigenous employment and earning capacity. Addressing employment issues will bring more money to Indigenous communities, translating to lower incidences of preventable disease. The effect of better employment prospects will be compounded generation by generation, improving the health of future generations. The prison cycle can, according to the Redfern Statement, the Department of Health, which represents the Commonwealth of Australia, and the second edition of the #JustJustice, can be avoided by investing in holistic community initiatives and social infrastructure. I want to point out an exception to the rule. As I've explained, socioeconomic status is an important social determinant for health. Additionally, a gender pay cap currently exists that benefits men. As you can see in the figure from Barron and Cobb Clark on the left, women in the public sector make up only 40% of the top 10% of earners. The private sector is better, with 47% of women earning a wage in the top 10%. Despite Australian men making more money, they live fewer years than women. The reason for this is women smoke less than men, and as a result have lower incidences of ischemic heart disease and lung cancer. Men are more likely to be obese and drink alcohol at dangerous levels, which, with smoking, increase the risk of ischemic heart disease. Additionally, men aged 15 years and over are 3 times more likely to die in motor vehicle incidences than women, and men are more likely to die from drug use and suicide than women. However, as you can see, there is a clear correlation between a person's earnings and the age at which they're expected to die.